Hello, my name is Dr. Jack Mydlo. I'm professor and chair of urology at Temple University Hospital here in Philadelphia, Pennsylvania, and I'd like to spend the next few minutes with you talking about erectile dysfunction. Briefly, the definition is the repeated inability to perform sexually for penetration. And the reason that happens is as a man gets older, these tubes, called the corpora cavernosa, fill with blood, and as they fill with blood, the penis gets engorged and hard enough to penetrate. Unfortunately, what happens is as a man gets older, less blood flow goes to the corporal bodies, and therefore the penis cannot maintain a hard erection. There are other medical conditions such as diabetes, hypertension, a history of cigarette smoking, and other factors which can cause a decrease in erectile function strength. So, fortunately, in this day and age, there are a lot of modalities we can use to treat erectile dysfunction successfully. One of these, I'm sure you're very familiar with, are the numerous medications that are out in the drugstores and pharmacies that are taken by oral intake, and these can help increase blood flow to the corporal bodies that can help your erections be stronger so you can penetrate. One of the other treatments, if the oral medications cannot be taken by mouth, are injectable medications. So if you're on nitroglycerin for your heart conditions, these will allow the medication to be injected directly into the corporal bodies, and that will stimulate blood flow into the penis to allow penetration. Another modality is the vacuum pump. And the vacuum pump, simply put, is a cylindrical chamber in which the penis fits in here, and by press of a button, it causes a suction vacuum that forces blood into the corporal bodies. Then, with a veno-occlusive ring at the base, it holds the blood in the penis in there so there can be penetration to complete the sexual act. Other modalities besides the medication, the vacuum pump, are the surgical options, which are the penile prostheses. The first one I'd like to demonstrate is a semi-rigid penile prosthesis. These are measured precisely for each patient's size and girth and length, and they're kind of like a gooseneck lamp. They are rubber coated with titanium metal bodies that allow it to bend in any which direction. Now, these do not enhance your intensity of orgasm, they do not enhance the libido or your sex drive, they do not enhance your sensation. They are merely to make it strong enough to penetrate. So these are merely mechanical devices. And once they are measured for each person's shape and size, they are placed in. When the patient is not having any sexual activity, he just forces it down. When he is ready for the sexual act, he just forces it up, it stays there, and he's able to complete the sexual act. For those patients that want something more natural, we have the inflatable penile prosthesis. And this is similar to the semi-rigid in that this is totally flexible. So it consists of three parts. One part is the corporal bodies that are measured to the shape and size of your penis, and these fill with water to make it hard enough to penetrate. There's a pump which controls the action, and this is placed in the scrotum. And then there's the reservoir, which is filled with solutions that are transferred from the reservoir to the corporal body. When the patient wants to start the erection process, he pumps the pump which is in the scrotum, and water is now transferred from the reservoir into the corporal bodies, making it stiff, as you can see, and this will allow penetration. When the gentleman is finished with the act, he can just squeeze the pump again and squeeze the fluid out of the penis, and it's transferred back into the reservoir. So this will allow the patient to have a normal, comfortable sex life like they had before they developed erectile dysfunction. So all these things are things that we can treat erectile dysfunction, and there's no reason why in 2015 any man should suffer from erectile dysfunction. We're here to help you. Again, my name is Dr. Jack Mydlo. I'm in the Department of Urology at Temple University Hospital, and you can reach me at 215-707-3742. That's 215-707-3742, and we are located in Philadelphia, Pennsylvania. Thank you very much.